right. Hello, everyone, and welcome. My colleague Jen and I are very, very happy to be here with you today and talk about a topic that is very close to our hearts in Health Innovation Northwest Coast. So, this is an informative session where we will explore different strategies for reducing health inequalities. We will look at leadership approaches that can be helpful in unlocking barriers and unlocking meaningful cross-sector collaboration. We will also share evidence-based methods for engaging seldom heard communities in co-design of innovative solutions supported by digital leadership. So thank you. Our aim is to share both examples and practical recommendations you can all take away. I am Alex Hernandez, a Senior Program Manager at Health Innovation Northwest Coast, and I am also the co-founder and engagement lead of the Latin Americans in Health and Care UK network. I am delighted to be presenting to you all today alongside my colleague Jen Cohan, who is the Head of Coaching and Engagement at Health Innovation Northwest Coast. We also want to thank all the digital health team for their support and for inviting us to speak today to you all. Thank you. If we go to our following slide. Thanks, Jen. This is our agenda. So first I will introduce the work we do at Health Innovation Northwest Coast, and then I will set the scene by defining health inequalities and digital exclusion and explain why this matters. After that, I'll hand over to my colleague Jen, who will take us through some leadership strategies and practical recommendations for supporting digital inclusion and tackling health inequalities. Finally, we will have some time for a Q&A, aiming to finish at 1:30 p.m. today. So before we begin, I just want to cover a couple of housekeeping points. This session is being recorded and will be shared afterwards. Please feel free to share anything you feel it's convenient in the chat. Share comments, resources, or any question. Let's keep this a respectful and inclusive space. We intend to all our attendees to feel in a comfortable space to share anything that you feel it's appropriate. So without further ado, let's get started. Thank you. We cover the next slide. Thank you. So for those of you who are not familiar with the Health Innovation Network, this network is the innovation arm of the NHS, and it's a collective voice of 15 health innovation networks across England. Some of the people may have heard about the HINTS. So we work with healthcare organizations and businesses to support the spread of innovation within the NHS, from new technologies to new ways of working and service improvements as well. At a local level, we work to identify innovation and improvements to specific problems. We also empower and engage with innovators and those developing improvements to further their ideas and get them in front of the right people at the right time. We also aim and work to advance the uptake, as I said, and spread of innovation and improvements by delivering national programs and initiatives within the NHS and social care. We have in our organization, Northwest Coast, we have a wide service offering, including innovation culture and engagement support, innovation support. We have complex transformation and change management and real-world evaluation. And of course, our work aligns with the ambitions and the aims as the objectives of the NHS 10-year plan. So today, our session will focus more on building a workforce that is fit for the future. Fantastic. Let me now move on into what are health inequalities. So according to the King's Fund, health inequalities are avoidable, unfair, and systematic differences in health between different groups of people. There are many kinds of health inequality and many ways in which this term can be used. So let's unwrap it a little bit more into two different things. Inequalities of what, and inequalities between who? We find inequalities, for example, in health status, in outcomes you may be familiar with, life expectancy, mortality, disability, for example. We can also find inequalities in access to care or the quality that staff provide. And there are also inequalities in behaviors. Some of them, they may be more risky, less risky. And all of the behaviors that we take they affect our life and health in different ways. For example, the decision to smoke or to drink. There are also wider determinants of health, and these include things like income, housing, transport, for example, just to mention some. We find inequalities between people or groups with different incomes, people living in different geographies or locations, urban, rural, and so on. We find inequalities as well with people that have specific characteristics of or demographic traits. But what we are talking about is something that it's not inevitable, and the gaps are not fixed. This is something fluid, this is something dynamic. However, evidence has already showed that if we follow a comprehensive and multifaceted approach to tackling them, we can make a difference. We can really achieve different outcomes. So let me now move on into digital exclusion. So in this slide, I am just showing a couple of facts showing that the digital divide is real. So I'm using this information as per the NHS England website. You can all go and take a look at pace when we share the slides, but just a couple of shocking and a bit sad factors and contexts that we are navigating now. So there's some percentage of households that still do not have internet access. There are a lot of people that are using their broadband packages and services as we speak within the current economic crisis. There is an important proportion of the population that still lacks access, skills, and confidence to use online services. People are trying also to access healthcare through online services, but lack trust in where the data is going, lacks trust in the systems that they are using, and also they do not know what to do. And this prevents them sometimes to access healthcare services. So NHS England, NHS local organizations, and also the wider public sector organizations have started to map out the different groups at risk of digital exclusion. And they have already started to make some moves and plans and shape their strategies around how to support them a bit better. So that's good news. Let's move on into the following slide, please. So let me talk about digital exclusion now. So digital exclusion, NHS England defines digital exclusion as a situation where an individual is unable to use or access digital services effectively. And often this is due to different reasons, factors: access, skills, motivation, and trust. I have mentioned access before, connectivity. People don't have the right devices, people don't have access to internet broadband, or they lack support of doing that. Skills, motivation, and trust, those are key factors as well for people being confident of using online services. Right, so digital exclusion affects someone's ability to use technology, shapes access to health information, services, and social support, and all of these affects, of course, health outcomes. So this is what we are talking about today as well. So if we move on into the following slide, why should we care? Why is this important to us? And that is part of the reasons that we decided to put this discussion together. So we want to create a better workforce that creates better services for underrepresented population and for the overall population. And for this, we must challenge our ways of working and actively address bias, both unconscious and conscious. This is something that Jen will talk more about in the following slides. So there is a tremendous amount of work being done already by national and local NHS organizations, a lot of guidelines that can be accessed by everyone to help NHS staff and enable and encourage greater access to more knowledge and improved experiences of healthcare. And this involves the increased adoption of digital approaches where appropriate. So an approach to promoting digital inclusion involves capacity building on ways to improve usability and trustworthiness of digital tools. So strengthening informal support networks through the community, for example, or investing in formal systems like digital champions or digital helplines is something that we have been able to experience firsthand. So cross-cutting efforts should also raise awareness of health inequalities and digital exclusion among all decision makers, and particularly in those with high deprivation in high deprivation areas. So hopefully that brings a sufficient case for all of us to be here and increase our literacy about this important topic. So there are recent narratives in our digital health community about the link between digital inclusion and digital clinical safety, based on arguments that the safe use of digital health tools depend on inclusion, where patients and staff need access, skills, and confidence to use digital systems correctly and safely. So again, this is a sufficient, important moral, business, and economic case. Right, so I'm finishing with this last slide before handing over to Jen. And just to say that our experience working in Health Innovation Northwest Coast has showed that there is a dynamic relationship between the design and implementation of digital tools. So this means that the design shapes implementation, and implementation shapes in turn the design, and all of these create different outcomes. So the extent to which this cycle becomes a productive working relationship, of course, depends on effective collaboration, engagement, and responsiveness of different people involved and different organizations, especially now that we are going into a neighborhood-based model that will become more and more of the things that we see online, in social media, and in our daily practice. Right, so fostering leadership skills is, of course, essential to fully realize the potential of digital technologies, whilst addressing digital inclusion and tackling health inequalities. So we are here to promote this leadership capacity building, and we hope that the following slides and information is of help. So please, Jen, tell us more about how we can all be better leaders advocating for digital inclusion. Thank you.
Thank you, Alex. That was a great introduction, and I hope everybody feels like they've got some sort of shared understanding now about health inequalities. What does this feel like, look like through a digital lens? And so now we're going to shift a little bit, and we're going to focus on yourselves as leaders and thinking about what are sort of some high leverage leadership approaches that you can take that's going to help you to align and really shift your mindset towards looking through the lens of digital inequalities, digital exclusion, and try to integrate that thinking and those behaviors through your leadership. So that's what we're going to talk about at this point before we do questions. Also, just reminding you, if you want to pop anything in the chat, an idea, a thought, a question, feel free. So I'm Jen, as Alex introduced me earlier, and I'm head of coaching and engagement over at Health Innovation Northwest Coast. And I like this image as a way just to think about, I think often, and you'll have found this yourselves, that people think that the tool, the technology, the item itself, the tangible thing, is in itself the thing that makes change, when really I think what we know is that it's our digital tools, our digital spaces, our interactivity, interconnectivity is what leverages change, really. And so I'd like you to think about that, of how can I then as a leader leverage the work that we do, the projects that we're working on, our programs, etc. So we're gonna, oh, sorry.
You are on mute, Jen.
I think it was my keyboard there. So we're going to talk about 3 approaches, and we're going to spend the most amount of time on the first one. And the first one is culturally competent leadership. And so we'll talk a bit about what does that mean. This is a really individual approach. Then we're going to move into thinking about values-based leadership and what you can actually do to to influence people around you, and sort of motivate folks to act in accordance with a more inclusive agenda. And then finally, we're going to take a wider view and thinking about an approach that you might want to develop for yourself as a digital social innovator. So we'll talk about what does that mean? What might that look like? So, without further ado, and this again, as Alex said, these topics are really close to our hearts. We spend a lot of time thinking and talking about inequalities in our systems. I'm a really big advocate for cross-sector working and collaboration. I think in digital spaces, it's such a no-brainer, so to speak, that we need to integrate across different organizations, patches, localities. So we always want to start when we're thinking about cultural competence and what does that mean for us as leaders. We have to start with the self. So I always think of this as sort of 3 concentric rings of the work that we do. And I've spent a good decade doing racial justice work, um, uh, and anti-racism work, and so you might hear people in those sort of communities talk about doing the work. Has someone done the work? And what they mean by that is, have they really addressed their own internal perspectives, experiences? Have they really thought about what it means to be interculturally competent? So so what's important about this is that you do spend some time thinking about your own individual experiences, your own perspectives, the sort of the mental models that you hold in your head, and looking to see the connection between when we have individual experiences or individual instances of health and care inequalities, and then translating that more widely to a system view. So where do we see the system impact of some of the smaller, more micro policies or processes that we set up in our systems that end up impacting people on an individual level and at scale as well. So what do we mean when we say culturally competent? What is intercultural competence? So this is a huge field of study, but essentially it breaks down into a couple of key areas. So being interculturally competent means you have a greater ability to make increasingly more complex perceptual distinctions around your experience versus another person's experience versus another group's experience. As you get better at basically navigating cultural experiences that are unfamiliar to you based on your own limited experience, then you become more comfortable in those spaces. So this is a sort of core tenet of this, what's known as the DMIS, which is the developmental model of intercultural sensitivity. And really what that means is we come to our experiences in our lives usually through an ethnocentric lens, which means we move through the world based on our own experiences. And you'll have known, you'll know this, that if you go and travel somewhere and you experience a new culture, it might be a bit turbulent for you at first. You're not quite sure, what's going on around you. But the more you experience it, the more comfortable you become. Same thing is if you expose yourself to different kinds of experiences, and people with different experiences, you absorb that ability to sort of move between different cultures. So that's the basic model itself. And what we find is that most people in the research are sort of in the middle somewhere of being on that journey of seeing themselves and their own culture as primary versus being an integrated part of many cultures. So the word culture itself can be tricky for folks, but we want to look through this lens. I want to look through a lens in particular here, because when we talk about digital exclusion and digital inclusion and eliminating those disparities, we have to think a bit about unconscious bias, because we know that it's bias very often, as Alex was saying, is what's underlying some of the the things we're doing that impact people in our communities. So essentially, and you'll have heard of unconscious bias. You've probably had a training in unconscious bias or implicit bias at some point. But I'm also a big believer that we can't train our way to equity, that all that we can really do is become informed and reflective leaders who, again, spend that time doing their work, their personal work. But again, unconscious bias just means that these are very often biases that are outside of our own consciousness. Very importantly, they often clash with our own values. However, they are so deep-seated in our daily lives, and sort of it's the smog we're breathing around us of inequity, that, and as the quote here sort of implies, that we're usually just on a moving sidewalk where we're moving along. There are policies and structures, like digital structures in place, that we don't pause, take time to reflect and deconstruct them so that they're more equitable. So what we really want to do is start from a place of equity and inclusion. So again, there's a big difference between explicit bias and implicit bias. So even though we might think on the surface that health inequalities is about an individual person experiencing some kind of explicit discrimination, that is not the case. Typically, those are very limited cases. While they're important, and we don't ever want to, we want to make sure that we put structures in place to eliminate them. Usually what we're talking about institutional systems of inequity. It's much bigger than that. It's unconscious, and again, it's usually built on systems that were designed inequitably from the get-go. So this is a slide that I like to also share that helps people think about different aspects of culture. And what this power wheel really represents is this sort of different aspects of identity for people. Now, I have to always say, as a disclosure, this is just one model. There are lots of models like this. This is probably not as inclusive as it needs to be. There are probably lots of refinements, but I think it's a pretty good representation of what our society looks like in terms of power, marginalization, and the privileges that come with being parts of different identity groups. So you can see that around the wheel, we're seeing those lenses of identity, different lenses of identity, and that power typically sits at the center of this circle. So you can sort of look around. I think, one example that I think is a really easy one for most people is that it's quite clear from the way our society functions that people who are property owners have more power than people who are renting or in other kinds of sheltered, accommodation. And then the people with the lowest power then are the unhoused or the homeless folks. So I think that that's usually a pretty good one to help people see how this works. And what it does is it just asks us to think about perspectives other than our own. And when we do things like, we use heat tools, the assessment tools, we really need to take a broad view of what inequity and inequality look like. So again, just in terms of you, and you're doing your own work, you're doing the work on yourself, that center of the concentric circles, that we have biases because our brain attempts to make shortcuts because there's so much stimuli coming into our brains. So our brains attempt to make shortcuts, and those shortcuts are usually based on long exposure to stimulus data that tells us a story about the people around us. So again, I always like to say, that this is something that's been reinforced for you through your whole life, and it's important just to draw your awareness to it and start to see where that might impact your usually it's not a direct decision. It's probably more of an oversight sometimes when we sort of fail to acknowledge the inequalities that could result from the decisions we make as leaders. So I'm just going to transition now into sort of the two other areas that I wanted to look at as far as what are those high leverage strategies or approaches you can use as a digital leader. So we started with, focusing on yourself, really thinking about what does it mean to be a culturally competent leader. And then the next one here is, and again, I think this is good for all leaders, but values-based leadership is a really nice place for you to center yourself, and think about your own development and how you might like to develop. But values-based leadership just means acting and behaving in accordance with your own values as a leader. Very, very simple. And so we'll take a little bit of a look at what that means and what goes into that. This, of course, is sort of the middle of the concentric circles. This is the others zone. So when you're a values-based leader and you lead with your values, you are impacting others, you're influencing others, you're modeling your decision-making, the way that you think through solutions, modeling that cultural competence, openness, transparency. It's so essential that we do this for the people around us. And that's not just for, if you're in a quote unquote leadership role, that your title, implies that you're a leader, because everyone we know is capable of being a leader in the way that they influence others through their behaviors. I'm also a very big fan of Michael West, who has written prolifically around compassionate leadership. So when we do send the slides around, there will be some links embedded to some of his work. Really good work around active listening, practicing modeling, when your leader is saying things like, I don't know the answer to that, but let's find out, and sort of putting your ego aside as a leader, to model, again, that openness, reflective practice, evidence-based thinking, evidence-informed thinking. So when we talk about values-based leadership, another term that comes up is this concept of congruent leadership. And, we know congruency is sort of when things stay aligned. So that's another way of thinking about values-based leadership. So essentially, this is about being authentic, really thinking about your values, doing that personal work. What are the values that are most important to you? But also thinking about your organization. What are the values of your organization? I think that, when very often when we come into sort of times of tension in our work, which we'll talk about in a minute as far as cross sector collaboration and collaboration in general, there are inevitably going to be tensions, whether they're tensions around decisions that need to be made, funding, shared resources, interoperability, all kinds of things. What we need to do as leaders is be prepared just to have challenging conversations and practice having challenging conversations. And that the thing I always come back to is, when I'm in a situation like that, I think, what are the values I want to lead with? Right. So if one of the values of our organization is courage, and very often I say to myself, I need to draw on that value of courage right now and ask a difficult question in a compassionate way, because I believe it's for the good of the outcomes for a project. When we're thinking about values-based leadership and being congruent with our behaviors and our actions and our modeling and how we lead, on behalf of others, it means being consistent. So that's, it doesn't mean that you can't change your behaviors or your decision making, but you're almost, in a way, someone might say, I wonder what Jen would do in this situation. Could they guess, right? Could they guess which way I was going to lean? That probably means I'm fairly consistent. If they say I have no idea what she's going to say, I have no idea what she's going to do, that might tell me that I'm not as consistent. That doesn't mean across the board that always needs to be the case, because perhaps, I do want to, as a leader, look at a new avenue or consider something new. And that's potentially because I'm activating the integrity inside of me and saying, oh, the right thing to do is actually, say this heat assessment we've done. I don't feel like it's as thorough as it could have been. did we really go through this was it a bit of a tick box exercise, or have we really pushed it out enough to consider everything that we need to consider? Reciprocity in this leadership style would also mean building relationships based on mutual respect. I think the whole leaving your lanyard at the door, leaving your title at the door, it's important, of course, for a person in a senior role who has decision-making responsibility to step into that place and use that power equitably and compassionately and with integrity, but giving as a leader again. So that's that reciprocity. Transparency, I've already mentioned. Communicating openly. If you're not sure about something, you say that. If there's been a delay to something, you try to be as clear as possible about why and how things might be rectified. And I also, finally, it's about authenticity and again, putting that ego aside. Sometimes that can be challenging, especially when we're working with others who have not put their egos aside. And so, again, you have to call on your values to help you navigate those situations. So again, what you're doing when you practice values-based leadership is you're modeling this to the people around you. You're self-aware, and you're noticing the impact of your words and your behaviors on others. I'll never forget when I had a manager who, I can be a bit intense, and I can get excited and very animated or passionate about something, and she would say to me, this is just some feedback for you, which kind of always makes you a bit scared. And then she said, I just want you to think about the impact your energy has on the team. Because sometimes you're really excited about something, but you seem really anxious, so it was important for me to step back and go, okay, oh gosh, what's my impact on this? So being self-aware. Finally, the last, we'll wrap up with this sort of last leadership lens, I suppose. And this one is by taking a view on the systems that we're in. And I get really excited. My background is in education sector, so I came to innovation and health and care through the education, the primary and secondary education systems. And it's really critical that when we're looking to eliminate health inequalities, we're looking wide. We're looking to collaborate with others who can join forces with us in our own resources, and then join forces to really create transformation. So this morning, Alex and I heard from a partner in our own system who's working on some fuel poverty work, and it was just a fascinating discussion about when there's urgency around making things better for people, sharing can become easier. So I would encourage you, as we look at the 10-year plan and we look at the ambitions of the NHS app, for example, that we think from the very beginning about inclusion and co-creation. And so co-creation is sort of the lens I'd like you to look through now, and thinking about the difference between co-production and co-creation. So I want to talk a little bit about that. Okay, oops, I went the wrong way. So what does it mean to be a digital social innovator? Digital social innovation is all about using digital to enhance social innovation. So that's exactly what we're talking about today, bridging this digital divide, cross-sector working, and reducing health inequalities through a digital lens. Then this is a perfect approach for us to consider. And so what this really means is about empowering communities, improving public services, linking up with other digital, you know, networks, essentially, to maximize the impact of the alignment that is in place, or that is beginning to take place. I think that very often when we talk about co-creation, what we really mean when people say, "Oh, we co-created this pamphlet, etc. I think what usually happens is people create a pamphlet and they run it by some people and they socialize it and they say, did we ask this group? Did we ask that group to look at it? And then it gets rubber stamped and it gets distributed. And that is not co-creation. That is consultation. So that is, seeking advice, seeking input. But what we mean when we say co-creation is starting at the very beginning, at the very, very beginning point of any collaboration or improvement, or innovation work, to include the communities who are impacted by the work. And this is you have to be careful that you don't approach this as a tokenistic activity, but that you create your own systems and processes to ensure that there is representation by people with lived experience in the design of your digital pathways, tools, whatever digital implementation you're doing. So it should be citizen-led, not top-down. What else did I want to say about this? Yeah, I guess there's a bit of sustainability plug there too. I think that what we find, the research is starting to really reveal, is that when you do co-creation for digital solutions, those solutions are much more sustainable. They need far less sort of overhauling down the road, because they've been designed from the beginning to be fit for purpose in a dynamic environment versus a fixed environment. So let's see, just as we're sort of starting to wrap up, weren't quite sure how long it was going to take us to get through all of our material, but we have lots to share if folks have questions. So again, just to kind of wrap up that concept of the digital social innovation. I think what we know from our work that we do as a sort of broker between innovators and academics and system providers and arms length bodies and voluntary sector colleagues, is that these are complex relationships. So you know I'm sure you're aware that there are, long-standing rifts, historical rifts between different elements of our health and care system. I think I'm probably not speaking out of turn when I say that our health and social care systems do not talk to one another effectively. And again, not necessarily because there's resistance to that, but there is a long history of just disconnectedness. And so when we think about now moving to these neighborhood models, which I am so excited about, and I know this is, tried to do this before and things come around, and cycles of change happen. I think we have such an opportunity to practice digital inclusion, to lay down the foundations for systems that eliminate health inequalities while we build a new model for the neighborhood hubs to help the people in our communities. So I get so excited, I got to keep myself on track. So just coming back to this, the ways that we would recommend that you approach this work is, number one, acknowledge those complexities, understand they exist, do your best as humbly as possible to just understand it. So if you're talking with someone in another organization or another sector, and there seems to be some obstacle or challenge, just all you have to do is just say, hey, how can we unpack this? Is there a way to understand this better, or work together to find a solution? I also really think that clarifying your communication and feedback needs with your stakeholders is critical. Understanding how they want to be communicated with, what's the best way for them to engage with you, and how will you sort of play back to them how they're contributions have been sort of integrated into your work and your plans. I would also think about, as much as possible, creating sort of shared medium, using a shared medium, using shared modes of communication, again, personalizing where needed, and making sure that access to communication and feedback loops is simple and accessible. So finally, in terms of this slide, I wanted to share with you this, what we used to call it the penny farthing model, or the someone else has called it the whirligig model, but this is our change model, our complex change model. So we know that digital integration and digital innovation um, is cyclical. It's iterative. You always have new information you're working with. So what we do is we use a design thinking approach, and we approach any solutioning through this sort of step-by-step and recursive model, where you're really understanding the need for your innovation, and you're spending lots and lots of time with the communities of people who are also part of that innovation community, or sorry, that impacted by and would be using those tools. So spending a bulk of your time really understanding the problem before you get to any hypothesis about what a solution might be. And then you do some testing, again, feeding back, making that iterative improvement inclusive, keeping your communities engaged. And then when you feel like you have a strong prototype to scale up, going through that process. But what we want to show with all of these loops and stopping points is these are the checkpoints. These are the points where feedback gets communicated, and there's a golden thread that's very inclusive throughout the whole creation process. So we can always talk about that more, but I think as Alex, I'll invite you to come in here as well too, but our thinking when we were planning for today was, how do we connect these things? How do we connect complex change, digital integration, and eliminating health inequalities, to these concepts of inclusion and equity and diversity. This last image here, the Venn diagram, I often find that people talk, they use these words interchangeably when they're not really interchangeable. So there's a big difference between diversity and inclusion. Diversity means representation and sort of a wide representation, for example, but that doesn't mean that people are actually included. They might be present, but not included. And then equity is all about power. So equity is about making sure that you redistribute power. And if that means that decision-making power in the development of, say, a new technological pathway or a new digital pathway, it might mean you have to give up some power to others to make decisions, because they're the people who are directly impacted by them. So I know those are big topics and sort of heady, heady work and heavy work. But we hope that that's been really helpful for you today. We do have some time for questions, so feel free to put them in the chat. I see that there has been some nice activity in the chat, and so happy to look through that. But Alex, if there's anything else that you want to add, obviously we're going to share slides, our information's there, but we love talking about this stuff, so please, I shouldn't say, here's a coaching tip for you. Instead of saying, do you have any questions, I guess what I'd like to say is, what questions do you have, or comments? So.
Thank you so much, Jenny. It was very inspiring, and I'm sure that all the people joining here think the same. As you say, people have been contributing with their comments. Some people have been sharing their links to documents, and and frameworks. So that is what we want. We want to motivate more discussion about this. This is, a new topic. It's not widely discussed. Some people is starting to make moves around diversity and inclusion, co-design and collaboration, but it's nothing that it's easy to do. Collaborating with people internally within our teams is difficult. So even more when we try to collaborate with other sectors, with other organizations, with slightly different values and so on. So digital impulses us, promotes or is inviting us to change our ways of working, our ways of leading, our ways of communicating and influencing at the same time. So I'm hoping that everyone is finding this really exciting, and it's pushing us into being more literate, more open, and having a
Yeah.
different
Yeah.
working style and dynamic.
Yeah.
So
Alex,
thank
I'll
you.
just jump in really quickly to just piggyback on what you were saying, and what I'm sort of seeing in the chat as well is that um, I think sometimes we make assumptions about what people understand or know. Um, Working in health and care is complex. There is a lot to know. And so I think that, I've been in the NHS system for about 8 years, coming in with absolutely no prior experience of the system, so to speak. And it's taken me that long to get a grasp of how complex it is, and how many initiatives there are and programs. And so I think you and I are in agreement on this. Our goal here is to help people gain a sort of baseline level of knowledge and then share resources so that people can go out and develop themselves, and join forces with other people, other like-minded people in networks like this, right? Communities of practice, absolutely, Joanne, absolutely. Um, so yeah, and then the other comment I had is very often especially when we do the work around power and unconscious bias, and doing that work and having, challenging conversations and courageous conversations. I always hear from people and they say, we never get the permission to talk about this. It's just an assumption that I'm supposed to be good at this, when I've really not practiced it very much, or I'm not confident. Going back to what you were saying, Alex, about it's not just about access, right? It's about skills, motivation, and confidence. So if we can apply that to ourselves as leaders, and then really do everything we can out in the community is to help people to build their skills, motivation, and competence to become digitally um, competent, and or be able to find the resources that they need, if they can. So, yeah.
Absolutely. Yeah, I'm just taking one of the comments in the chat. Michael says we may miss something important. So it's having that empathy. I think that we are missing things because we have one experience and it's taking the best of others, working in different fronts with different agendas perhaps, but working towards the same purpose. So that's really important. And we're hoping that these different strategies in terms of being a more competent leader, more compassionate leader, help us moving forward and keep the discussion going. So brilliant. Jen, we have only a couple of minutes left, so I would like to take two questions that we have from the audience. So which of the three leadership approaches discussed earlier feels most relevant to the work of the Health Innovation Network and other organizations that are including innovation? And then I have another one. What's one practical way leaders can make co-creation more genuine? Thank you.
Yeah. Yeah.
Big
Those are,
questions there.
they are big questions. I think values-based leadership is probably the highest leverage thing that you could start focusing on right now today, right? So I think that's eh, in some ways it's an easy one because if it's based in your values, you're closest to it. So as far as, I think we've been on a bit of a journey, even in our own organization, from being really almost completely funded nationally to having not so much national funding and really needing to make some decisions about how we were going to sustainably support the system and stay afloat, essentially. So those were there. We had some really difficult questions to struggle with for a couple of years around income generation. How are we going to charge colleagues in the NHS if we're from the NHS? What does that feel like to us? So I think that those are, we have to wrestle with our values when we're going through times of change like that. And then I think the other question you asked was around the co-creation and how to make co-creation more effective or authentic. And so I think, we're living in a time where crowdsourcing has never been easier. Now, that doesn't mean that crowdsourcing doesn't come with its own mixed bag of pros and cons in terms of logistics management, data, all of that. But I have always tried to err on the side of I have a former colleague who used to always say, I'm just going to be radically inclusive. So I've tried to adopt a mindset of radical inclusivity, thinking about what are all the channels that I can open to make sure that people can get to the information that they need and the services they need. So it's not about what's the best option, it's about what are the best options, right? So always in coaching, we want to think about multiple possibilities for success, leveraging the strengths that we already have, what's already working, and again, like never, in some ways, never believing that we will always have the full answer. That you don't go out once to a patient advisory group and check in on something. You create a relationship with patient advisory groups, and you become co-designers, and it's not a one-off. So as much as possible, I know that that's something in our organization we're really leaning into this year, is adopting more of a patient, public, professional involvement and engagement unit. So it's always going to be a challenge, but when I look at our stakeholder lists, I always say things like, we don't have enough young people, we don't have enough people from this region, we don't, so it's really keeping an eye on your representation in your stakeholder groups. So those would be my tips. And I know we're coming up to time, but I could talk about it forever.
Thank you. We can all do, because this is an exciting topic. Well, we only have a couple of more minutes left. I don't know if anyone else has more. We have already starting to get very positive feedback and comments. Jen, I'm gonna tell you that this has been a very exciting conversation, and I can feel that people feels the same way. This is certainly not a one-off session. We need to keep talking more about it. We need to be feeling more comfortable with the change and with becoming a little bit more literate about the topic. Maybe I would like, I received just another question. What do you think is the biggest barrier to digital inclusion in the NHS? If you want, I can cover some of it, Jen, and then if you can complement it, that would be brilliant. This is a very important question, and this is shaped, of course, by a mix of factors, and I just would like to highlight a couple of them. So access, we have been mentioning it already, skills and confidence, and trust and motivation. So access is a big thing that we may underlooked in some ways, but when expanding or providing digital services now, even more with the plan of going from analog to digital, we need to be mindful that people sometimes don't have devices, don't have internet connection or enough data. So let's not forget about the cost of living crisis and this context. Skills and confidence is another one, and this just does not affect only patients, but also staff. Let's not forget that staff need to be reskilled and need to feel confident of what they are using in their practice and what they are suggesting the patients to use as well. So staff need to be seen as users as well in all when we talk about digital technologies. Trust and motivation. There is still a big chunk of the population that say, I'm not gonna submit a form online simply because I don't know where my data is going, who's using it, and what is happening to it. Still, people feel that they are keen sometimes to to give their data if this is going to have a difference in their health. People is, we cannot just simply put everyone within the same cup, but we need to be mindful that there is a big chunk of the population still need and they need reassurance about their data and their transparency. So that's really important. There is an interaction between these factors happening as well. Let's not try and think that the patients and the staff, are made up of different 3, 4, 5 groups. Let's not do that. Things are fluid and are dynamic, and strategies and pathways, pilots, and all these projects, they need to be mindful of the different types of the population being impacted. So here I finish with this. Jen, I don't know if you would like to complement it.
I think just to say, going back to those ideas of if we design our systems for people who have the least accessible, methods, or who live with the greatest uncertainty, or the largest social determinants of health, etc., it's always easier to move from that space of greatest inclusion and inclusivity, and do that in parallel with personalized care. So if you think about that circle that I showed earlier with all of the power, we are never one wedge, right? We are a lot of those different wedges. Each of us fits into all of those different spaces. So if we design things that are widely inclusive, we are casting the net wide for the greatest success for our populations. So Alex, thank you so much for partnering with me today. It was your idea to do this, and I'm really grateful you brought it up. And we couldn't be more grateful to the folks at this network for helping us set it up. So
thank you.
that's
Thank you, Jen. Well,
Madeline
you
and
followed
Lynn.
up, so thank you for all the inspiration as well and all the knowledge that you have brought to all of us. Well, we finish with these 4 spare minutes for everyone before going into the following meeting. Please make sure that you keep contact with all of us. You have our website now. You have our contact details. We are always having an open door. Get in touch with us, and we will be happy to support you as you need moving forwards. Thank you to the digital team, and thank you, everyone. Have a lovely day.
Bye.
Bye.